Sanbonani, hello, hi, and welcome to Top Woman, where we sit down and dissect powerful women who have paved the way for others to follow. Namhlanje, it's another awesome day where we're talking to a legend in the making. It's a very interesting character, and it's not what you're going to expect from today's show. It's going to be fun, informative, and we get to know the story behind the name. My name is Zama King McClure, the king with the most, your host, whose smile opens waves, njalo njalo. Stay tuned at the Vertebrae Production. Like and subscribe.
So the gynae aspect refers to a non-pregnant woman, and the obstetrics refers to care during the pregnancy.
Where's there were a point where you said, I can't do this? Like, this is too heavy. I know you spoke about seeing all the sicknesses, the ailments and stuff. Because I think it's different seeing a textbook and actually dealing with day-to-day people.
It's good to have a good. It's better to have a good support system. You know, that's very important because one, medical school is drooling. Okay. We're young when we enter there. We're 18, 19, and we're giving up a lot of our time to actually progress, you know. So there have been many times, but I think the worst was during my training. We have created this boss woman, but an unapproachable boss woman. And that's where we need to stop. We need to say, here I am, I've made it. Come to me if you need any advice. If I have anything to share, I will share it. And if it helps you, that will then be my achievement as well.
Today we're going to be talking with a fantastic, beautiful woman who's operating in Melomed, a private hospital based in Zululand. And we're looking at something that a lot of women are afraid to talk about, the sector of OB/GYN. I'm not sure what that is fully to understand what it is, but today I've got Dr. Suvarnah Bodasingh, who's going to explain more. Hello, Doc, how are you?
Fine, thanks, and you?
I'm good. So, Doctor, today, for today's show specifically, can I call you Dr. B?
Yes, please.
Yes, please, you're going to make it so formal. So, I found out that you grew up KwaDukuza. You know, that is very fantastic, and I want to know more. So, take me back. You now, maybe let's say 5-6 years old. You're sitting at home, KwaDukuza, with the family. Close your eyes. Tell me, what do you remember? What do you see? What do you hear?
So at that age, I was in my grandparents' house. Okay, I think that's where a lot of my time was spent. And I think, you know, with working parents, you were always left to the disposal of the community, which at that point was my grandparents, which they're very dear to me and helped shape the person that I am. So yeah, in that farm kitchen, you know, with their cabinets half falling off and the stove or the oven that doesn't work. But yeah, so if I think about it, think back then, that's where I would be. And happy. You know? Or sneaking little treats from their cupboards, which would have been like peanut butter and golden syrup in that tin that used to come in before.
Yes.
Yeah.
So do you think, like, I know you spoke about the community, and I was raised by grandparents as well, so I know that love and family orientation was a big thing in that household. Do you think it shaped the way you grew up?
100%. I think, you know, a grandparent's love, yes, your parents' love and attention is important, but a grandparent's love is different. You know, it has no boundaries, it has no limitations. It's forever accepting of you. You know, your parents always want to shape you, but I think grandparents just accept who you are. And I think that obviously gained or built my confidence in myself. Yeah, definitely.
And became the beautiful woman that you are.
Thank you.
Today. So, fun fact, I heard Dr. B that ukhuluma Zulu.
Yeah.
You are fluent in isiZulu. Was that based from where you grew up? How did you develop that strong language? Because I heard the accent, so I'm hoping I'm gonna hear a few Zulu words today. And how has that shaped you from your youth growing up to this field, being able to communicate in isiZulu?
So I grew up on the farm. okay, on a sugarcane farm. So I was always outside. And I remember there was this Mkulu that used to help us in the garden, and I was always with him. He was, I used to call him Malum Dube. And he was this old man, and I remember his grey beard. So I don't remember actually learning Zulu. So by the time I went to school and it was done as a second language, I already knew Zulu.
Fluent, yes.
So I think obviously it was the interactions in the garden with him that allowed me to pick up the language. It's like, you know, they say when you're like 3 or 4, you don't really learn or have to be taught a language, you pick it up automatically. And I think that's where it came from. So now I definitely think it's helped my career. Because even post internship, post qualifications, I came across to this side to practice and do internship. So meeting patients in UKZN, I was able to understand it. And I think, you know, yes, you know, there's sisters there to help you translate or think, but I think you miss the emotion. You miss the pain that comes with their description or patient's description. So I definitely think it's helped me understand my patients a bit more and even communicate, because I can then explain what I think you're saying to me, or at least like a back and forth conversation where you actually can get more out of just a single translation. Okay, this is what the complaint is.
So while you're on that and you're speaking about patients, the field that you're in is OBGYN. So for the followers at home and the listeners and watchers, can you just explain to me quickly what that is? Yes.
So it's an obstetrician and gynecologist. Like, so commonly referred to like a woman's doctor. So anything woman health related. So from the time you're a child or reaching puberty, right up until menopause. So the gynae aspect refers to a non-pregnant woman, and the obstetrics refers to care during the pregnancy. So it's care of the pregnancy and the fetus up until the post-delivery period.
Oh, okay. So I heard you mentioning UKZN Hospital, and when we start the conversation, we were speaking to you about you being based in a private hospital. Being in UKZN, which we all know is a public hospital, and you being fluent in Zulu, has that, I know you said it helped, but does it lighten the load? Because I know, especially in most communities in the townships and rural areas, things like that, like female doctors, it's not a conversation that is usually had. What challenges have you come across being a specialist in that field and in townships and rural areas specifically, and getting them comfortable with you?
So I think first of all, when I first started, which was a couple of years ago, seeing a female doctor was an issue because they thought I was a nurse. Yeah, which is, and I think we all, each healthcare provider has their role, but it was to see the female, you know, the female face as a doctor, as a young doctor. So even I remember there was this one Mkulu who came with a urological problem. And obviously now having to explain to a young female doctor that this is the issues I have did not go down lightly. So we had to actually just call in a male colleague who he was then comfortable with to disclose this is what's happening. So I think in that regard, then it was an issue. I don't think it's an issue anymore. I think there's more female faces out there.
Yeah, definitely.
You know, and even in the public sector, a lot more females out there. Yeah.
So you speak about OBGYN and how you grew up, you're family based and stuff like that. And I think when most people grow up like children, you say, I want to be a doctor, but nobody's ever specific in which field they want to practice in. Was there ever a space where you're saying, I want to be a doctor when you grew up? Like, what do you want to be when you grow up? And then when did you phase into now from just being a medical doctor and being a specialist in the OBGYN field?
So I think I definitely wanted to be a doctor. You can specifically, can I pinpoint a reason as to why? No, I can't. I just knew that I wanted to become a doctor. So I know it's odd. But I think when I hear my parents and, you know, elders describe the type of person I was, and as a child, I think I was still the caregiver and tried to get everything right, you know? I mean, when you grow up in a less privileged community, there's always issues and you want to be the fixer. I was the eldest daughter, so I think that also plays a bit of a role. But in terms of obstetrics and gynecology, so I really enjoyed the field when I came across to Queen Nandi during my internship. That definitely shaped me. I enjoyed the doctors that were there that trained me, and I think that definitely impacts on the field that you want to go into. So I knew leaving medical school, I wanted to go into one of the surgical disciplines. So in medicine, we always say there's a medical and a surgical discipline, or non-surgical disciplines. So definitely wanted to be in theatre. But I think, my mom had, I think, 4 to 5 miscarriages and a stillbirth before having me. So her experience, I think, also shaped what type of discipline I wanted to go into. And I think it was more personal related, because obviously I heard, sometimes it's difficult to speak about those losses.
True.
But when it does come out, it really hurts. And you see that a woman carries this pain throughout her life,
True.
So I wanted to be one of the doctors that helped, and I think ComServe, or community service, I did it at Catherine Booth Hospital in Gingin Global.
Okay.
And at that time, we as community service doctors were put into the medical wards. So a lot of chronic diseases. So TB was quite rife, HIV as well, okay? And that was at the time where the rollout wasn't as aggressive as we are now, in terms of treatment. So I used to see a lot of patients that were like chronically ill, which, doing that for a year can become a bit depressing, And then I realized, obstetrics is the one discipline where you're actually giving life and helping someone bring life into this earth. And that's what I want to do. I know in medicine you can't choose in terms of what patient walks through the door. Yes. And I'm happy to deal with any of them, but I will be happier to deal with someone that I'm actually helping bring a child and bring life into this world.
That's so beautiful. I think sometimes when we think about the medical field, we think about problems, and we don't see the beauty of that, talking about, especially in this day and age now, the amount of rainbow babies that people talk about. 100%. And in communities, it's still seen as such a failure as a woman if you have a miscarriage. But there's so many things that happen in your body that we don't actually talk about. So I'm glad that you took that and took it as a strength to venture forward with. And you speak about your tenure in Queen Nandi and the other hospital you did the training.
Yes, at Catherine Booth Hospital.
Catherine Booth Hospital. So now tell me, now you in fresh from doing your in-service training and all of that, where's there were a point where you said, I can't do this? Like, this is too heavy. I know you spoke about seeing all the sicknesses, the ailments and stuff, because I think it's different seeing a textbook and actually dealing with day-to-day people. During that training period for you, how was it? Was there ever a time where you like...
I think there's many times where you're like, I just want to throw in the towel.
Yeah.
And I think that even started in medical school, but my parents were very supportive. And now my husband, I was dating at that time. Ooh. Yeah. But I think, it's good to have it's better to have a good support system. That's very important, because one, medical school is grueling, okay? We're young when we enter there. We're 18, 19, and we're giving up a lot of our time to actually progress, So there have been many times, but I think the worst was during my training. So reg time, for anyone that's been through it, will tell you that's probably the toughest time for them. I mean, you want to just leave. But so I felt pregnant in my 3rd year, which everyone, when you like a registrar, you shouldn't be pregnant. Like, this is a tough time already. Exactly.
How do you balance? I get it.
And so it was COVID as well, after I had my son, and my husband was unemployed at that time. Yes, it was, I think, the worst time. I think I remember counting how many diapers I can use in a month, just to get through. But, as I said, the support system is important. And I had really good friends. So yes, there's been days where you think, okay, I'm done with this. Can I have just a career a change? but I think it was a combination of all factors, not just a specific incident. Because I think I still love what I do. So, no, there was no specific incident.
I love that we getting to know that other side of you, because I also think that in I know you do like your conserve and community work and stuff like that, but there's sometimes a stereotype where it says if you guys work in private hospitals, then you might not understand the day-to-day struggles of the people in the communities that you serve. So hearing that what you went through COVID, which I think for the whole world was a shocker, and seeing you in this beautiful space today, still smiling, still finding a light in what you do, is so beautiful to see. Just a quick one, side note. How was operating during COVID? How was that? Outside of the fact that you're a new mom with the society in a whole not knowing what's going on, how was the medical field space that time?
It was scary. So I was at Addington Hospital at that time, still under training, and that was going to be the first hospital that was going to take all these COVID cases in. So I was very scared. I had a newborn at home. So my husband and I made a decision that we're gonna spend time away from them. So basically, I would stay in Durban, and then they would go to Stanger and live with my parents and my in-laws between the two houses. So I missed out on a few months with my son, and that's when he was starting to walk.
Important milestones,
but it's, we didn't know what we know now.
Wow.
We were acted out of fear. Whether it was a right or wrong decision at the time, it was a decision we took. So I think in terms of that was a difficult point.
So you're just talking about the decision making and the fear with what happened with COVID. Now you work in the public sector as well. You do a lot of work there, and you started there as well with your training. Now, I just want to know, we know for a fact, it's a conversation that's usually had in South Africa, that the public sector is not fully awarded or afforded the necessary material for them to assist more and better than they could. So now, as a surgeon yourself, how has that experience been? Because now I think you can't just rely on your skill and the material you have. It's your resilience. How do you manage that?
So I think, the good thing about the public sector is that you're working as a team. Okay? So that helps, because at the end of the day, we can do as much as we can. And I think it's also important to acknowledge your limitations, as a person. So the fact that you have a team and that you can actually call on a senior to support you or to give you guidance, that's what I appreciated when I went to work at Queen Nandi. There was this lovely doctor, a very good surgeon, Dr. Myatt, who taught us a lot. And I remember him, he would, if you called him into theatre to assist you, he would stand close by, and then he'll ask you, do you want me to scrub it? And you're like, okay, maybe. He's like, try it and do it. And then just having that reassurance of someone's got your back, you were able to do it, But he was always there, ready to scrub it if necessary. But I think the public sector teaches you that you have to try with what you have, because you're not going to get it anywhere else, I think in terms of patients-wise, as you said, we are all aware of the restrictions that they are there. But still, you have to offer the best care that you can. And that too is, there's a ethical term, it's distributive justice, where whatever you provide, you need to be able to provide to the entire community, and you can't limit that resource or whatever you have to one patient. So I think when we're in public, that's how we practice. And it also helps comfort us in the sense that we are providing the basic care that we can to everyone that needs the service.
That's good to know, because sometimes you have these fears and things that are not spoken about as well. So I'm sure the viewers at home have just that extra landed comfort knowing that the doctors really try their best, no matter the circumstances that they found
100%.
themselves in.
I think, when we were at Queen Nandi, we used to do outreaches as well. Okay. and that's going to the district hospital. So even though you thinned out in terms of staffing in a regional hospital, and it's difficult, but we still were able to or try to provide that service and that support for the doctors on the other side, which are like hundreds of kilometers away. Yeah, but I think I don't think anyone in the public should dispute the fact that we try. All the doctors try that are there now.
Yes. Love that. So one thing I've heard, congratulations first and foremost on your honorary. I know you have heard your honorary lecture at UKZN. Obviously, I would love for you to tell us more about that. But also, you now here. What advice would you give to Dr. B on her first day at residency?
Oh gosh, I'd be like. So I think definitely just realizing that you're a student. You know, medicine has a lot of expectations, you know, and probably expectations that you put on yourself at some times, but just realizing that you will not know everything in medicine. You are constantly learning. And I think it's one discipline and avenue where you will learn from every single patient you see. And no one patient is the same. I don't think any patient matches the textbook identically. So it's a combination of experience and textbook knowledge. So definitely I would tell myself that I'm not expected to know everything, and I'm still a student and I'm here to learn.
Do you have any regrets?
Probably being too hard on myself. And probably expecting me to be more capable than what I should have been at the first year. Yeah.
Just a quick one, do you think being a female played a role in that pressure that you put in yourself? I know when we started the conversation, we spoke about how in some hospitals people still had that belief that a doctor needs to be male. So do you think in any aspect when you were doing your residency and you're seeing other students, you put that extra pressure on yourself because you are a woman?
I think following my pregnancy I did, because I wanted to finish in the time frame. So you have 4 years of training and you have to finish your research, or you should finish your research and write your final exams within that 4 years. So definitely when I felt pregnant, I was like, this is not going to stop me. I have to finish it in the 4 years. So yes, the added pressure, because it's not easy preparing for final exams, first of all, and then having a 6-month-old that now demands your attention. So I remember like downloading a whole lot of articles on my phone, and even like bedtime was then some time for me to just read through an article. So I think then just the dual role of mother and student did add a bit more pressure. Yes.
I love that you entered into the space of you being a mom and striving through that. I think that's why women are bomb, because we are able to multitask and make it through. That's why you're a top woman. You were able to do it. So I just also wanted to tap into, now you're a mom, you're a doctor, and you're a mom to 2 boys, and I know they're super energetic, boys will be boys, as they always say. How do you find the balance? You know?
It's funny. I was asked this question last year as well. And I must be honest, I don't have a clear-cut answer. I just try every day. Because I think, when you're with kids, you just need to be present at that time. So I think they know when I leave the door that I'm going to work and I need to be present for my patients. So I think the other day I brought my eldest one through, so he can actually see what I do. What does mommy do? Where does mommy work? Why does she leave the time she leaves to get here? Why does the other day my little one, the 3-year-old, he saw me dressed in scrubs as I got up, and he's like, "Mama, where's your pajamas?" And then, so I think, you have to explain that this mama goes out at times when you are sleeping. So I think in terms of that, it's just being ever present at that moment and making sure you give them the most attention that you can when you are there. And I have an amazing helper, Magazi, who's my lifeline, because without her, who holds that household together, none of this would be possible. Not at all. Because she helps me raise my voice.
There's a conversation I want to go into, Dr. B, and that I feel like women struggle a lot with. For so long, we've been made to choose, whether you choose to be a career woman or you choose to be a mom. Personally, two of you, do you think you ever felt that pressure or that certain, I don't want to say disappointment, but that extra strain that, I wish I had my children later. I wish I had done things differently. Maybe if I got married later, all of that pressure. Because you find so many women are restricting themselves in their happiness because it's the career first and you can't have the career and the family.
So, I mentioned about being pregnant or falling pregnant during reg times. And it was such a taboo. It was never thought of that a woman could specialize, and then it was always you specialize, or then you get married, then you have kids. But I mean, medical school is what, 6-7 years? Then if you get into that reg program straight out of what, 2 years of internship, 3 years of consult, so that's like 10 years. Then you do 4 years, that's 14 years. And you can't put your life on hold anymore. As we said, there are many more rainbow babies. There's many more pressures of society. So I definitely think that, yes, it before was thought of being taboo, but many women are like, no, we're gonna get both, and we're gonna take both with both hands.
You bring a sense of warmth and empathy in our conversations. Do you think you being a mom, it makes it easier for you to practice as a doctor? Because you, like, even having this conversation now, it's like, it's not even a conversation, or it's literally, I'm having a kiki with an old friend and I'm getting inspired. Do you think that warmth and empathy comes from you being a mom and having to strive through all of that?
I definitely think falling pregnant helped shape the obstetrician that I am today. Because sometimes you never appreciate, and we have this term called minor ailments of pregnancy, and only when you're experiencing it do you realize it's not minor. Yes, it's regarded as minor in the textbooks, but it's not minor at all. So I definitely think, one, being a mom, it also teaches you patience, and teaches, I always say, before people used to say, your child will teach you things, and I never understood it. Never. Until you go through it and you realize, oh, this 3-year-old is actually teaching me something, So yes, I do think that we learn a lot from our kids, and it has definitely shaped my character
as well.
Yeah, definitely.
Now it's a touchy subject that I want to get into, but you're a mom, and you work a lot with expectant moms. You work a lot with moms that have lost their children. Now, is there any sort of pressure that comes with that? You being a mom yourself, you've been through pregnancy, you've been through childbirth, and I've been through childbirth, and I know that's the scariest period in your life. Nothing makes sense. You can watch all the YouTube videos.
Please don't watch the YouTube videos. All the TikTok videos. Please.
You think you have all this information. Now you've been through it twice. And does it make it easier or harder to engage with your patients? Because you've been through it. So you definitely understand what they fear. Because I came in, you'd see the movies and you'd be like, contractions are not that bad. She's probably acting. Now you understand that it really is that bad. The fear that goes in, but you also need to be like sympathetic, but also be dutiful in making sure that they get the best care.
So I think, one thing, you cannot disregard anyone's symptoms. That's utmost importance. And at the end of the day, going through it, yes, it makes you a bit more experiencing, but at the end, your threshold, my threshold for pain is completely different. And understanding that whatever this patient is going through at this point in time is her experience, and you want birthing to be a nice experience. Yes, I think empathy is important during that time, and because also these moms need reassurance. A lot of the times, it's not just pain medication. They need just reassurance and they settle down, you know. Obviously, not all our moms are privileged enough to have a supporting partner right next to them, you know, which I think that also plays a big role. And if anyone has a partner, you should be supporting them at the delivery room.
They need all the support.
Yes. So I think definitely it helps me appreciate what they're going through, but also doesn't take away the medical aspect of things. And when I need to be assertive, I will be assertive. I will be, and I'm sure my patients have realized that. There was a patient of mine the other day, but it was a post-procedure, not a delivery patient, and she's like, "No, you just, you know, you're a pretty face, but when I saw you say what you said, I realized when you mean business, you mean business." So yes, I can be assertive.
That's my next question. You know, actually, because we deal with it a lot. That as women, you need to be. They like using the word aggressive. But you need to be tougher, you need to be stronger, you need to be more assertive, you know. But you are usually labeled as softer, as empathetic, and you know, do you think, have you found the balance of saying, listen, I can be soft, I can be your hug when you need it, but we need to get work done, we get work done. So is it okay for a woman to actually fall into her softness, like be into a womanhood and not always be, it's beautiful being a boss babe, but it's okay being softer.
I agree. I mean, that's why we're women. You know, that's why we are able to have the two sides of the coin. You know, we're able to manage a boardroom and still manage a household and raise kids and provide that comfort that you need. So I think also it doesn't take away from your character or your strengths. It actually multiplies it, yes. You know, and each setting demands different things from a woman. You know, I don't know whether I'm allowed to, but I'm a Hindu. So in Hinduism, there's a goddess that has multiple hands, and each are carrying different strengths, just showing you that a female has different roles, and each are equally placed, meaning that they all carry the same amount of importance. And so I think as a woman, we have multiple phases as well as strengths. So definitely, being both is important.
I don't know if I'm allowed to say it. So I can low-key feel like women are gods, like with 100%. The small g.
100%.
So with all of that you do, a little birdie told me that you are known as the traveler. So you've done it all. You've worked so hard, and most doctors say once they've achieved it, they wanna walk away from where they've been. They have a certain lifestyle they want to live and all of that. But apparently you travel. You go back to Nongoma, Eshowe, and you help those communities. Please firstly tell me more about that. And Dr. B, why do you do it?
So I've always loved community medicine. Like that's why I chose to come for internship to rural areas. I think, you know when you see that gogo that probably has spent an hour or more traveling to get to you and is now appreciative of just seeing you and having you treat her there so that she doesn't have to travel 200 k's to get to me or whatever the case may be. Just that simple satisfaction of giving someone an easier life or encounter is what I do it for. I don't do it for anything bigger. I love seeing the community, and actually when you go out there you appreciate what resources do they have available. When I ask you to do an investigation that requires you to come to the lab, can you get to the lab? Do you have a lab in your community? Probably not. I will probably have to arrange with the GP kind of thing, which it's feasible, yes, it's there, but it also you understand what is at their disposal. Are they still dependent on public transport to get to you? Which means that this lady still has to get up at this time to get to you. So I think it's very important, and I would encourage any doctor who's treating a community to actually go to the outskirts and see where your patients are coming from. And there's a discipline, family medicine, which that's what it taught us. You should be a doctor that comes from that community, so you understand the community as well.
Is there a difference between the regional hospitals that you've worked with, and then, because I do believe if you go to those outskirts, like from your Jozini's, mostly it's like localized, smaller clinics. Do you see the difference there in the healthcare? More than anything, information that the patient has. Like, do they understand your discipline when they come in? Because most people, they only have a matron. That's the top hierarchy. And so how is that reception? And it's basically not only are you helping, but I believe you're educating at the same time.
So I think, previously when I used to work at Queen Nandi, we used to go to the district hospitals, but now we are actually going to GP practices, because of the private sector. Yes. So, you know what, with information technology, everyone having access to a smartphone, everything on Google or ChatGPT or TikTok for that matter. Yes. I think patients are aware of the type of discipline. They may not understand everything, because as you rightfully said, one of the other patients that came through, like, but what is an obstetrician? Like, I mean, it's a doctor, but why is this doctor different from the doctor that I've been seeing all this time? So yes, I think at times you have to explain it and they may not understand, but I think now we can use terms like women's health, and yes, it rings a bell. Okay, so this is what this doctor does. She just deals with women, or she just deals with lady problems. But does the entire community know what an OBGYN is? No.
Do you ever have problems where you find patients, because there might be some stigma, not that it might be, I know in a few communities there still is that stigma about female problems, be it giving birth, getting pregnant, because sometimes it's not us, it's your partner, and there's that stigma around that. Do you ever have a problem where a patient is not as forthcoming with their problem, and how do you deal with that?
Definitely. I mean, I think a lot of times, especially if it's a couple that's come through and the mom doesn't want to disclose anything, you can see. And what I then do is probably during the examining time, when I'm alone with the mom or the patient, then ask her a few questions like, are you comfortable? How's things going? The thing is, you need to get to know your patient. Like, are there any stresses at home? That kind of thing. And slowly you will realize somehow when she feels comfortable with you, she's gonna disclose and she's gonna mention, okay, 1, 2, and 3. And that's when, like, these conversations that are just by the way is where you actually pick up.
Oh yes.
But your patient just needs to be a bit more comfortable with you. You need to, and it's not that you need to show that you're actually concerned about the entire dynamic. It's not, and whenever, as you said, and it mostly happens in infertility and when you're looking for the cause, I always ask my patients to please at least bring your partner in, because then hopefully when it comes from a doctor, not that it makes much of a difference, but when you explain it, then they hopefully appreciate that it's concerning, because the pressure of pregnancy, even in the outskirts, is very high and it's very real. Yeah,
I can't even imagine. So tell me the beauty. That's like when you help her, when they give birth, or more specifically in the rural areas, when sometimes, because you've got people that have issues where not that I'm knocking any practice or anything like that, but the belief system that traditional medicines might help, and a person might be having a problem with their cervix or the womb, and it's been going on for years, they've been in pain. A lot of people, even now, we're still trying to TikTok what cysts are, and how do you get them, and all of that misinformation that we say. Because here's another thing with social media, which is worse. I feel like as you go down the demographics, it gets worse. I know if you stay in the suburbs, or for example, you're more exposed to know that this is AI.
Yes.
This is fake.
Yes.
This is
100%.
And in areas where information is not that passed around, it gets anything is the truth.
100%.
You know. So how does it feel knowing that you break down a stigma, you help that person, and you change a life?
I don't know. I think for me, any small achievement, I think I've learned now to at least pat yourself on the back, kind of thing. But it's like a surreal. It's just this happy like feeling that it's more like, oh gosh, like bubbles, like champagne in your tummy. Yes, exactly. And you're like, oh, I've got this one. Yeah, no, definitely. And I think, another thing that I want to maybe touch on is even the exposure, the TikTok and all of that. I just wish it was used for better needs, because yes, patients can come in very misinformed or think that a simple headache could be something drastic as well.
We're dying.
Which it is difficult because now we're fighting the stigma of community. We're then fighting the AI. And surprisingly, this type of information is very weighted in terms of their opinion. The patients would rather look at or listen to that, and it makes it difficult as a doctor then to break it down and say, you know what, but let's look at it. Is it reasonable? Because you also don't know what they've read, what they've listened to say, but they've just heard a point, which I think I wish TikTok and or other forms of social media actually educated patients rather than gave out a different or a wrong message.
On a side note at that, Dr. B, would you look at, I know you've got your practice, I know you've got your community work, but do you think in this day and age, it's important that more doctors get on the platform to try it? Because I know for a fact, I've been guilty once or twice where I've Googled symptoms and I've probably had cancer 4 times now in my life, according to Google, and sometimes you want to have a friendly face, telling you that actually minor symptoms, because sometimes it's not even the cure that you want, but preventing
100%.
it, I know for a fact, and this is now a sensitive conversation, but especially with OBGYN areas, I'll say that to be politically polite, there's so many things that are used to tighten, to help conceive, and all of those things, cinnamon, Epsom salt, do this, a bubble bath, your knees steaming, all.
You took the words out of my mouth.
Do you think in this day and age, it's important for doctors to get on the platform? Is it something that you'd say it's part of your duty? Or do you say, once I walk out of my office, then it doesn't have to be a consultation or anything like that, but a lot of issues that come in again and again,
So I definitely think it's important for us to educate. That's part of what we should be doing, whether it's sitting at your consultation or whether it is social media. I definitely think doctors can play a role in educating and sending the right message out there, whether it's going to reach every single patient, but it's going to reach someone, which will then change someone's life. And I think that's a start, because that person then who comes in, if they do come in and they need to come in, gets rightfully educated, and then they go and spread that to the community. So I think it is a good platform, provided it's used properly. You've
stayed. So I'm just, as you're speaking and it comes across to me, you've worked in this area quite some time, and more than anything, you've worked with women a lot. I know we speak about the girl child going forward, but we still have a few things pulling us back. In the field that you're in the health profession, do you think there are certain things that can still be done to take the girl child to the top?
100%. I definitely think so. One, just knowing that it's possible. younger women seeing you, people like you and I,
Yes.
as a familiar face that's in my community, that came from my community and is now able to get to where they are today, probably had the same struggles that I do right now. So yes, I definitely think so. And I think it's more about them familiarizing themselves with stronger women, you know, whether, and I would be open to being in a community where we could actually show that this is where I started. You know, I didn't have all that I have right now. I probably don't have too much, but still, this is where you start. And even if it was, I think, you know, that community-based talks for young women, that tells you simple things. Like, I remember seeing a patient the other day, it's probably off topic now, but something as simple as, what do I expect from a period, you know, from a menstrual cycle? And she's been having these heavy bleeding since she started. Didn't care to ask someone, is this normal? And I think that's where we lack, you know. We have created this boss woman, but an unapproachable boss woman. And that's where we need to stop. We need to say, here I am, I've made it. Come to me if you need any advice. If I have anything to share, I will share it. And if it helps you, that will then be my achievement as well.
That's beautiful. Dr. Bodasingh, we've spoken about your past. We've spoken about you now. So to wrap this up, now imagine you 20 years to come. Your last born, the 3-year-old. Terrible twins.
I think that's lasting for, I don't even know.
My son is the same age, so I can imagine. You're not alone.
Yes, we were dressed up in Spider-Man. And we couldn't
it's Spider-Man every day. Spider-Man every day. But we top women, so we have to make it work. So now he's 23. He's varsity almost done and whatnot. And it's 20 years later. You've lived your legacy. You've done everything. What would you want to be remembered for?
I want to be remembered for helping or changing generations. I want to be remembered for helping someone as young as your sister, to someone as old as your mom or grandmother. I don't want to be known as, I think it's part of my identity. I don't always like being called doctor. I actually just like being addressed by my name because I was myself before I was a profession.
Yes.
But I think in terms of my career, I would definitely want to be known as having helped many women. And I think that's generations of women.
Dr. B, thank you so much. I enjoyed this. I forgot actually that we were on a podcast. It felt like we're going to have some tea and crumpets during this conversation. Thank you for being a boss babe, if I can say so myself. But more importantly, thank you for reminding us that being a woman, being a softie, being beautiful and empathetic is still in style.
Thank you.
Ladies and gentlemen, that was Top Woman with the beautiful Dr. B. And make sure that you subscribe, so we can take you through the journey as we talk to more bad and important women. My name is Zama King McFleur. This was the Top Woman.